Hello and welcome to the Hip and Knee Replacement channel. I'm your host, Dr. Yuri Kerbal, and today we're going to be talking about a topic that almost everyone asks me about when I discuss knee surgery with them, and that is, when can you get back to driving after a knee replacement? And I get it, this is a really important consideration because it's a key part of getting back your independence and mobility, and especially if you don't have tons of family and friends to drive you around all day long, it's a key part of planning for the first few weeks after your surgery. So what I want to do in today's video is look at the evidence, the research that's been published to find out when it's actually safe for you to get back to driving. And we're going to be looking at a few things. Number one, are there any insurance or legal considerations that you have to know before getting back behind the wheel? Number two, when is it safe for you to do so? And are there any special precautions that you should take to make sure that you're keeping extra safe in your car as you recover from your knee replacement? And number three, when do patients actually feel like they can drive safely and get back to feeling normal behind the wheel? So stay tuned and let's check that out in today's video. So first up, we're going to take a look at the legal and insurance considerations, right? And this was interesting. I actually didn't know this before preparing for this video, and I did wonder about this. Are there any insurance companies that have any stipulations or any Department of Transportation rules? So let's find out. Here we go. This study looked at 4 different countries. It looked at the USA, the UK, Canada, and Australia. And they asked 5 of the top 10 insurance companies in each of these countries, as well as the Department of Transportation, whether there were any rules or regulations around getting to driving. And the interesting thing they found was when it comes to insurance, no stipulations at all. All the insurance companies said whenever you and your doctor say you can get back behind the wheel, you can get back behind the wheel. So that's good to know. And then in terms of any Department of Transportation recommendations, again, not much out there, certainly nothing concrete or restrictive. In the USA, they recommend 3 to 4 weeks, but this is not a rule, it's just a recommendation. In the UK, they say it's up to the patient and the doctor. In Australia, they say it's up to the doctor. And in Canada, they say 2 to 8 weeks for a right knee and 2 to 6 weeks for a left knee. So overall, from an insurance and legal standpoint, it really doesn't matter. Whenever you and your doctor feel safe, that's okay. There's no universal rules here. It's about when you and your doctor feel safe. So that's great to know. Next up, let's talk about safety behind the wheel. Okay. So when we think about being safe with getting back to driving, the key thing that comes to my mind, at least, is you want to make sure that you can brake in time. If there's a situation where you need to hit the brake pedal emergently with your operative leg, can you do that quickly enough and hard enough to stop safely? So that's what the next studies are going to look at. The first one we're dealing with here is looking at the brake reaction time recovery. And this is talking about the time it takes you to recognize that you need to stop and to step on the brakes. Can you do it quickly enough after you've had surgery? So this study was really interesting. They took 47 patients and they looked at the brake reaction time before surgery and then at 2, 4, 6, and 8 weeks after surgery. And interestingly, they found that 83% of patients were already back at their pre-op reaction times at just 2 weeks after surgery, which is amazing. So from their standpoint, even at 2 weeks after surgery, you're already back where you were. And interestingly, they also looked in relation to the safe braking time. This is a value that's decided by the Department of Transportation. They actually say you need about 1.25 seconds, 1.25 seconds, in order to be able to have that reaction time. And they found that all of these patients had a time that was below that amount at just 2 weeks after surgery. So this study seems to indicate from a brake reaction timing standpoint, it is safe to get back to driving at about 2 weeks after surgery. Okay, but that's one element, is the brake reaction time. What about the force that you can put on the brake pedal, right? Because that's another consideration. So this study was really interesting. They looked at about 30 total knee patients and they compared them to about 45 healthy controls. And they gave them a braking simulator, which shows them, they're sitting with a pedal, shows them a car stopping in front of them, and they have to see how fast and how hard they can hit that pedal. So what they found was that at 3 weeks, their reaction times returned to pretty much to normal. So similar to the other study, maybe a bit longer, but the braking force, the amount of force that they could put on the brake pedal was 200 newtons less than before surgery, than compared to the healthy control. Sorry. So what that means is you're putting a lot less pressure on that pedal and it's going to take you longer to stop. And to quantify this, 200 newtons less of force, if you're going at 30 miles an hour, which is an average residential driving speed, it's going to take you about 1.5 meters further to stop. And I realize I'm mixing different measurement units there, but it's going to take you 1.5 meters, which is about 5 feet or so to stop when you're going at 30 miles an hour, an extra 5 feet of stopping distance. And if you're going at 60 miles an hour, then it's even further than that. Then you were talking about 3 meters or 10 feet. So what's important to know here is that since you can't hit the pedal as hard, even if you are back to reacting normally, you probably should leave some extra space between you and the car in front because it's probably going to take you a little bit further to stop adequately. However, the good thing with this study is at 6 weeks, they found that everybody was back to normal in terms of brake reaction time and force. So by 6 weeks, things should be good. But it is important to keep in mind that you're probably safe to drive at about 3 or 4 weeks, but your braking might be slightly weak until about 6 weeks. And so you probably should leave a bit of a greater distance between you and the car in front during that time. Now let's look at when patients actually return to driving. So it's one thing saying that you're cleared to return to driving, but when do patients actually feel like they can really get back behind the wheel and drive like their normal selves? So that's what this next study looked at. And they looked at several hundred patients from the institution and they asked them, when did you drive again? And they also looked at if they had any accidents or injuries along the way. And they found that the average answer for patients who had a knee replacement was 4 weeks after surgery. And it's important to say one thing. All of these studies, and what I'm talking about here is in America, where we pretty much drive automatic cars and don't use our left leg for driving. If you're in a country so most of these studies are appropriate for right knee replacement. If you're in a country where it's mostly manual cars and you're using your left leg, the same principle applies basically to the left side. But in general, if you're talking about an automatic car where you don't really use your left foot, you can probably get back to that in about 2 weeks because it doesn't really make much of a difference with that leg. And there is one study we're going to talk about in a second that actually mentions that. So that was just a sidebar. But now getting back to this, the interesting thing they found was patients felt that they could get back to driving at 4 weeks after surgery. And interestingly, less than 1% of these patients had an accident, and even out of the few who did have an accident, none of them got injured. So again, this bodes well for the fact that you will get back to safe driving in just a few weeks after your knee replacement. They also looked at some factors that delayed a return to driving, and most of these are pretty common sense. People who aren't feeling safe, who still have pain, if you used a cane before surgery, or if you had a right knee replacement versus a left, all of these kind of make sense, but it's just a few extra data points about people who might take a bit longer to get back to normal driving. So from this study, the bottom line is the average patient is going to return properly to driving at about 4 weeks after surgery. And now to tie it all together, what do the systematic reviews say? So I love to look at systematic reviews when I'm looking at research, because what systematic reviews do is they take a whole bunch of different research studies that have been published on a given topic, and they group them together to see if there are any commonalities or themes that emerge where the studies agree or disagree. And it gives you a good overall idea of the general consensus of the research on a particular topic. So when we look at the systematic reviews about driving, these two were published. They both looked at pretty much the same study, so I lumped them together. And they concluded, they agreed that for a right knee replacement, this is again with an automatic car, your brake time is back to normal at about 4 weeks. And for a left knee replacement, again with an automatic car, not using a clutch, your brake time is back to normal by about 2 weeks. So it kind of validates what we've seen so far. So again, bottom line is safe to drive by 4 weeks after a right knee replacement. So what is the summary of all of these research studies, right? We see that there are no real laws or regulations regarding getting back to driving. It's up to the doctor and the patient to decide when they feel that the patient is safe. Also, most people regain full braking ability by 4 weeks after surgery, but some people might be safe as soon as 2 weeks. And finally, most patients are back to driving by 4 weeks after knee replacement. But remember that there is a little bit of weakness there, so you should keep that distance further from you and the patient in the car in front of you. Hopefully they're not a patient as well. So to put it all together, what are our final recommendations for when patients can get back to driving after a knee replacement? If you're driving an automatic transmission, and so you're not using your left knee to drive the car at all, it's probably okay to get back to driving at about 2 weeks after surgery. Really, you just want to make sure that the wound's healed a little bit, you're off narcotics, and you can move around adequately enough to get into a car, and then you're safe to go. If you're talking about a right knee replacement, then obviously it's going to be a little bit longer. And based on the studies that we've seen, you could be okay to start driving as soon as 2 weeks. But I always tell patients, be a little bit safe and start at 3 weeks just to give yourself a little bit of extra time. And know that you may not be ready until 4 weeks after surgery, especially if you have some of those risk factors like extra pain and lack of mobility, like we spoke about earlier. It's really important when you start getting back to driving that you do it in a slow, quiet place. I always tell patients, go to an empty parking lot or a cul-de-sac or something like that, and just practice gentle, slow driving and practice stops. Practice slamming that brake pedal. Make sure that you have enough mobility and you're out of pain enough to be able to do that safely. And then once you regain that ability, you can get back to faster speed driving, start driving around the neighborhood, start going on highways, and go back to driving that's a little bit more interactive and a little bit faster paced. It's also really important to make sure that you're off narcotic medications or any other medication that could make you drowsy and impair your judgment and your reaction time behind the wheel. And finally, as with all things to do with joint replacement, just listen to your body and make sure that you're safe. It's all about keeping you safe, and nobody understands your body better than you. So that's going to do it for the video today. I hope you liked it. Hope you got something out of it. If there are any other questions that you have or any other topics you'd like to see me cover in a further video, please feel free to leave a comment down below. And if you enjoyed this video and got value out of it and think other people might too, please make sure to like and comment and subscribe and hit the bell and all that good stuff to let YouTube know to get this video out to as many people as possible so that we can fulfill our mission of helping as many hip and knee replacement patients get back to an active, pain-free life after their surgery. Thank you again so much for joining me today. It's been a pleasure having you. I'll see you in the next video. And until then, I wish you health, happiness, and a quick return to an active and pain-free life. Take care.